vaccinating murderers before your granny. Does that make sense? Hi, I'm Brian Lilley, political columnist with the Toronto Sun. Conservative leader Aaron O'Toole started a controversy the other day on Twitter. And by controversy, I mean he said something very reasonable, something, well, that was common sense. And of course, that had liberal Twitter losing their collectivist little minds. What did he say? Well, here's the tweet. He basically said he didn't think criminals, inmates, should be getting vaccinated before vulnerable populations and frontline healthcare workers. That's what I think most of us believe. And in fact, I also think that's what the public health recommendations are. But more on that in a minute. It wasn't just random people on Twitter getting upset about this. Bill Blair, the Minister of Public Safety and the man who made this decision to start vaccinating prisoners, well, he reacted in this way when asked about it.
Let me be really clear on something. First of all, I think that all of us, including the province of Ontario, have a lot of work to do to make sure that we have, an efficient and effective rollout of the vaccine for all of those who need it. I would also simply remind the Premier and the Conservative leader that frankly, the language of resentment and fear really has no place in this discussion. It really needs to be based on the advice of our public health authorities.
The language of resentment. Is that what this is about? No, this is about making sure that vulnerable people are looked after first. And I understand there can be vulnerable people in prison, but Bill Blair also makes it sound like he and the Trudeau government are following the public health advice. That's not exactly the case. Check out this document. It's from the National Advisory Committee on Immunization. These are the people that came up with the rules on how we would vaccinate people, when we would vaccinate, and who would get the vaccination first. Take a look at this section. There's stage 1 recommendations, and I'll read off who's supposed to get vaccinated first. Residents and staff of congregate living settings that provide care for seniors. So, nursing homes, long-term care homes, whatever you want to call them. You live there, you and the staff that look after you should get vaccinated first. After that, adults 70 years of age and older, beginning with adults 80 years of age and older, and decreasing the age limit by 5-year increments to age 70 as supply becomes available. Okay, so that's stage 1. And they also add healthcare workers, including all those who work in healthcare settings and personal support workers whose work involves direct contact with patients. And then finally, adults in Indigenous communities where infection can have disproportionate consequences. In that case, they're talking about people in remote areas where they don't have easy access to hospitals. The remote communities where if an infection gets in there, it will have deadly consequences. That all makes sense, and those are the recommendations that people all agreed to. So why the prisoners now? And, well, wait, did you see prisoners in there? No, you didn't, because they're a bit further down. Scroll through the document until you get to stage 2, where in stage 2, after all those other people are looked after, you're supposed to get healthcare workers, not included in the initial rollout, residents and staff of other congregate settings, quarters for migrant workers, correctional facilities, homeless shelters, and then essential workers. Ladies and gentlemen, the idea that this is a public health decision and that the Trudeau government is listening to public health advice, it's not borne out by the facts. This is a political decision, one that the Liberals are defending vigorously while claiming that if you believe otherwise, you don't have compassion, that you're into the language of resentment. Nobody of any serious note has said don't vaccinate inmates. That would be wrong. We do have a duty of care to them. We absolutely do. And Bill Blair was right when he said that. But he's wrong when he's saying that he's following the advice. The advice would be that the doses we have available should be going to the people in stage 1. And that those people, including your granny in long-term care, including the healthcare workers that look after her, that they should be vaccinated first. That the age population over 70, the most vulnerable population in the country when it comes to COVID-19, should be vaccinated first. The fact that they're doing prisoners before the people in stage 1 shows that they have made a political decision, not a health-based one, and they're defending it by trying to turn it into a wedge issue to attack conservatives. That's wrong, no matter how you slice it.